A hospital can treat a patient perfectly and still not get paid. Sounds crazy, right? But in healthcare, getting paid doesn't just depend on treating patients well. It depends on something happening behind the scenes, medical billing. And here's the surprising part. One tiny mistake in the billing process can delay payment for weeks, sometimes even months. So what is medical billing really? Why is it so complicated? And why do so many healthcare organizations struggle with denied claims and delayed reimbursements? At its core, medical billing is the process healthcare providers use to get paid for the care they deliver. When you visit a doctor, hospital, or clinic, your treatment has to be translated into something insurance companies can understand and process. That's where healthcare billing comes in. Medical billing connects three major pieces together: the patient, the provider, the insurance company. Here's a simple example. Imagine you go to a clinic for a sore throat. The doctor examines you, maybe runs a test, and prescribes medication. But the clinic doesn't automatically get paid. First, someone has to document what happened, convert the visit into medical codes, create an insurance claim, and send it to the payer for review. And this is where things start getting more complicated than most people realize. Let's break down the medical billing process step by step. 1. Patient registration. Everything starts when a patient checks in. The front desk collects information like name, insurance details, date of birth, reason for visit. Sounds simple, right? Not exactly. Even a typo in the insurance ID number can cause claim denial issues later. And healthcare teams often don't realize there's a problem until weeks after the claim is submitted. 2. Insurance verification. This step confirms whether the patient's insurance is active, what services are covered, whether prior authorization is needed. If this step is skipped or done incorrectly, providers may deliver care, only to discover the insurance company won't pay. And yes, that happens more often than you'd think. 3. Medical documentation. After the patient visit, the provider documents everything that happened during the encounter. Symptoms, diagnoses, procedures, treatments. This documentation becomes the foundation for the entire revenue cycle management process. Because if something is missing here, billing problems can snowball quickly. 4. Medical coding. Now comes medical coding. Coders translate the provider's notes into standardized medical codes used by insurance companies. These codes explain what condition the patient had, what services were provided, why treatment was medically necessary. And this is the part many beginners underestimate. One incorrect code, or even one missing modifier, can stop reimbursement completely. 5. Claim creation and submission. Once coding is complete, the billing team creates an insurance claim. Think of the claim as a detailed bill sent to the insurance company. The claim includes patient information provider details, medical codes, charges supporting documentation. Then it's electronically submitted to the payer. And this is where things break down for many organizations. Because insurance companies don't just automatically approve claims. They review everything carefully. 6. Insurance review, claim adjudication. Insurance companies review the claim to decide, is the information accurate? Was the treatment covered? Was it medically necessary? Were the codes submitted correctly? This process is called claim adjudication. And there are usually 3 outcomes. The claim gets approved, the claim gets partially paid, the claim gets denied. And denied claims are a huge issue in healthcare billing. Sometimes the reason is complex, but sometimes it's something incredibly small. A missing signature, an expired authorization, a typo, an incorrect code. That's all it takes. This is the part most people never see. Behind the scenes, billing teams deal with constant operational pressure. Claims get denied. Documentation is incomplete. Insurance rules change. Staff are overwhelmed. And every delay affects cash flow. Imagine treating hundreds of patients every day, but not knowing whether you'll actually get reimbursed correctly. That's the reality many healthcare organizations face. And here's the difficult part. Even experienced billing teams struggle with this. Because healthcare billing isn't just paperwork anymore. It's a constantly changing system with thousands of payer rules, coding requirements, and compliance checks. One payer may require a specific modifier. Another may reject the exact same claim format. Now multiply that across thousands of insurance claims every month. You can start to see why revenue cycle management becomes so difficult. So why does medical billing feel so complicated? Because the system itself is complicated. Healthcare organizations deal with constant insurance policy changes, different payer requirements, complex medical coding systems, manual workflows, multiple software platforms, large amounts of repetitive administrative work, and most processes still depend heavily on humans catching mistakes manually. That creates bottlenecks everywhere, especially when staffing shortages and rising patient volumes enter the picture. But here's where healthcare operations are starting to shift. More healthcare organizations are now using AI and automation to improve medical billing workflows. Not to replace billing teams, but to help them work faster and more accurately. For example, AI can help with identifying coding errors, scrubbing claims before submission, detecting missing documentation, verifying eligibility automatically, preventing claim denial issues, prioritizing AR follow-up work. Instead of spending hours manually checking repetitive tasks, billing teams can focus on higher-value work that actually needs human judgment. And that's becoming increasingly important as healthcare systems grow more complex. Because the future of healthcare billing isn't just about working harder, it's about building smarter workflows. So what is medical billing? It's the process that helps healthcare providers get reimbursed for the care they deliver. But as you've seen, medical billing is much more than sending invoices. It's a massive operational system involving documentation, medical coding, insurance claims, payer rules, compliance, and constant follow-up. And even small mistakes can create major payment delays. That's why efficient revenue cycle management is becoming critical for modern healthcare organizations. If you found this medical billing explained video helpful, make sure to subscribe for more content on healthcare billing, medical coding, and RCM in healthcare.